Hello everyone, my name is Kayla Steele and my project proposal centers on the effects of cognitive behavioral therapy or CBT in depressed adolescents. Adolescent depression is a big issue in healthcare today, with suicide being the third leading cause of death in young adults. So obviously we need to find an effective and safe treatment to improve depressive symptoms. There's already been a lot of research done on CBT in adolescents. Posel et al. 2013 found that in a sample of over 500 U.S. high school students that CBT decreased depressive symptoms as opposed to those who underwent just normal health and wellness classes. Alavi et al. 2016 found that CBT over a 12-week period decreased the depressive symptoms in suicidal Iranian teenagers. Bella Awush et al. 2016 found that classroom-based CBT intervention administered over 5 weeks decreased depressive symptoms in students in southwest Nigeria. And lastly, Clark et al. 2016 found a decrease in depressive symptoms among adolescents with a diagnosis of depression who were also refusing to take antidepressant medications at that time. These studies had varying lengths of time as far as the intervention goes, from the 4-week CBT intervention in Clark et al. 2016 to Alavi's 12-week intervention of CBT. So my project proposal is to see kind of how CBT affects adolescents with a diagnosis of depression. And the population I would be working with would be the Graves-Gilbert Clinic Department of Pediatrics here in the town of Bowling Green, Kentucky. I would begin by recruiting an interprofessional team. I myself would be the team leader. I would have a faculty advisor, and then I would also need to recruit a therapist or counselor with experience and training in administering cognitive behavioral therapy to teenagers. As far as budgetary concerns, I would attempt to find a counselor or therapist who would be willing to volunteer their time. So we would begin by accessing the Graves-Gilbert Clinic or GGC's Department of Pediatrics health records and finding teenagers between the ages of 13 and 17 who have a diagnosis of depression. They would also, if on an antidepressant medication, would need the dosage to have been unchanged for the last 3 months. I would need participants. Inclusion criteria would include English speaking, and then also the ability to get transportation to the CBT sessions, which would be held at the main campus of Graves-Gilbert Clinic. That way it's not more inconvenient than them coming in for their primary care visits. CBT sessions themselves would be administered over an 8-week period. It would be 8-hour-long weekly sessions. I would use the Children's Depression Inventory, which has been shown to have a Cronbach alpha of 0.86, and that would be administered at baseline and at 1 week post the end of the intervention. As far as recruitment goes, once potential participants have been identified through the health records, they would be mailed a flyer or informational pamphlet to their home address, and those interested would hopefully reach out. The project leader or myself would have a meeting with each participant and at least one parent or legal guardian to explain what this project is about, kind of explain cognitive behavioral therapy, how it works, and to gain consent from the parents and assent from the participants themselves. At this meeting, if the participant agrees to continue in the study, I would also administer the Children's Depression Inventory. The teenagers or participants would then undergo the 8 weekly sessions, and then 1 week post the last session, I would meet with them and their parents again to get some feedback on what they liked, what they didn't like, any of their recommendations, and also to administer the CDI again to see if any scores have improved. As far as keeping track of patient identifiers and demographics, this would be done in an Excel spreadsheet that could only be accessed by the project leader or myself and the faculty advisor. As far as children's depression inventory scores, the therapist would not have access to those scores pre-treatment. So they would only have access to those scores after they have completed the cognitive behavioral therapy sessions for all participants. This data would then be analyzed, and after the data has been analyzed, all records of personal identifiers would be destroyed. As far as disseminating our findings, I would like to make a poster and place it in Graves-Gilbert Clinic Department of Pediatrics for other primary care providers to see, and for family members and adolescents themselves to see, to kind of spark an interest in adolescent depression and treatments for it. I would also like to present this at a monthly meeting of providers for pediatric patients at Graves-Gilbert, just with a PowerPoint and a verbal presentation to kind of encourage primary care providers of pediatrics to screen for depression, and then encourage those who they find may be at risk to seek treatment. Thank you so much for listening to my presentation, and hope that it's been informative, and maybe one day we'll actually get to do a project like this.